Good day, I am Trisha Cuevo, a BSN student from College of the Immaculate Conception. For today's return demonstration, I will be changing an intravenous container, tubing, and dressing. First is to assess any presence of fluid infiltration, bleeding, or phlebitis at the IV site. Assess if the client has allergy to tape or iodine. Assess the infusion rate and the amount absorbed. Assess if there is a blockage in the IV system. Assess the appearance of dressing for integrity, moisture, and need for change. And also the date and time of the previous dressing change. Determine primary care provider's order for changes in fluid administration. Then we will now assemble equipment. Administration set including sterile tube and drip chamber, timing label, sterile gauze for positioning the needle. For the dressing, clean disposable gloves, sterile 4x4 gauze, adhesive remover, chlorhexidine swabs, alcohol swabs, tape, and towel. We will now obtain the correct solution container. First is to read the label of the new container, then verify that you have the correct solution, correct client, correct additives if any, and correct dose, number of bags or total volume ordered. So now let's proceed to implementation or procedure. Introduce yourself and verify the client's identity. Explain to the client what you are going to do, why it is necessary, and how the client can cooperate. Good morning, ma'am. I am Trisha Cuevo, your student nurse for today from College of the Immaculate Conception. May I know your name and birthday? May I check it on your wrist tag? Okay, thank you, ma'am. So today, I've been ordered to change your intravenous container, tubing, and dressing. We do this to reduce the incidence of contamination of intravenous solution or tubing. And also, the dressing that is damp needs to be changed. While the procedure is ongoing, I need you to stay still, ma'am, alright? Okay, thank you. Perform hand hygiene and observe other appropriate control procedures. The rationale of this is to prevent the spread of microorganisms. Provide for client's privacy by closing the curtains and door. Set up the intravenous equipment with new container and label it. Ma'am, excuse for a while. I'll be setting up the IV equipment and apply a timing label to the container, then prime the tubing and label it. Then prepare the IV needle or catheter tape and the dressing equipment. Prepare strips of tape as needed for the type of needle or catheter. So I'm just gonna hang the pieces of tape from the edge of the table. And I'm just gonna open all the equipment, the swab, dressing, adhesive bandage, and I will put a towel under the extremities. And I will apply clean gloves. Remove soil dressing and all the tape except the tape that is holding the catheter or IV needle in place. Ma'am, I'll be removing the tape and gauze from the old dressing one layer at a time. And also, I'll be removing the adhesive dressing in the direction of your hair growth if possible. So, ma'am, alisin ko na po. And discard the used dressing materials in the appropriate container. Assess the IV site. We will now inspect the IV site for presence of infiltration or inflammation, or go to step 8, or discontinue or relocate the IV site if indicated. Ma'am, may I touch your hands? Okay, thank you. Okay, ma'am. Disconnect the used tubing. I'll be disconnecting the used tube, ma'am. Then I will place a sterile swab under the hub of the catheter. And then clamp the tubing, holding the hub of the catheter with non-dominant hand. Loosen the tubing with the dominant hand with the twisting and pulling motion. Then remove the used IV tubing. Then place the end of the tubing at the basin or other receptacle. Connect the new tubing and reestablish the infusion. So, ma'am, I'll be connecting the new tubing. So, continue to hold the catheter and grasp the new tubing with your dominant hand. Remove the protective cap and maintain the sterility. So, insert the tubing end securely onto the needle hub. Twist it to secure. And then we will open the clamp to start the solution flowing. Remove the tape securing the needle or catheter. Okay, ma'am, remove ko na po So, when removing this tape, stabilize the needle or catheter with your one hand. Clean the IV site. We will start with adhesive remover to remove the adhesive residue. Then, using a chlorhexidine swabs, we will clean the site beginning at the catheter or needle and cleansing outward in 2 inches diameter. We must follow agency protocol about cleaning procedures. Okay, ma'am. Nililinis ko na lang po yung IV site. Okay. Yan, ma'am. Retape the needle or catheter. So, for a butterfly needle, we will apply strips of tape to the wings of the butterfly using crisscross method. For a catheter, we will apply the tape using U method. Then we will apply gauze dressing to the IV site. we will remove the gloves. Label the dressing and secure the IV tubing. So we will place the date and the time of the dressing change and the initials either on the label provided or directly on the tape of the dressing. Then we will secure the IV tubing with additional tape as required. Regulate the rate of flow of the solution according to the order on the chart. Lastly, document all relevant information. We will record the change of the solution container, tubing, and dressing in the appropriate place of the client's chart. And record the fluid intake according to agency practice.